Hey there, everybody. This is Melanie Headley. You are listening to ToRAISE Questions Doula podcast. I'm sitting here with ToRAISE Hakoon. This beautiful, hot, humid, thick day. ToRAISE Hakoon is the executive director of ToLabor, which is an international doula training and certifying organization.
Yes, it is.
Yes, it is.
Hi, Melanie.
Hi.
This is ToRAISE.
And we've got some workshops coming up, don't we, ToRAISE?
Yeah. So we have a limited schedule this fall. So we'd love to encourage you to take a vacation and take a workshop at the same time. We're having one in Stanton, Virginia, which is in the mountains of Virginia. It's beautiful.
I know someone going to that one.
Yeah?
Yeah. Kylie, here's a shout out to you. I'm so excited for you to take the training.
Great. September 30th through October 2nd. Beautiful time of year to be in the mountains with the fall colors. So check that out. We'll be in the what's called the Triangle area, Raleigh-Durham, in October, end of October, the 21st through the 23rd. Again, great place to come and take our training, travel to. And then November, looking far ahead, the beginning of November, first weekend, Portland, Oregon. And as you said, you would love to come.
I'm just going to jump in your suitcase.
Yes. And it's a great city, and it's a great workshop site that we do it at a birth center, and it's lovely. So consider coming to Portland and spend a couple extra days either end of the workshop. So, and also I just want to mention once again, Latched Mama. Latchmama.com. They are a sponsor for us of this podcast, which we truly appreciate. And reminding you that the coupon will be running out soon. It is podcast 10, and you get 10% off. Pass it on to your clients. Use it yourself.
I just got a gift certificate for them and put it in my little postpartum package for my clients, just as a little gift.
That's really nice. Nice idea. So thank you to Latched Mama. Check them out. We love Melissa and all that work with her. They're a great crew of people.
Absolutely.
Yes.
I love all of them.
Yeah, me too. So thanks. And so today we are going to hear a case study. Yeah.
And we're going to be talking to Sue Ellen from Wisconsin. We love getting emails from you guys, and Sue Ellen wrote us a really great email just kind of outlining this birth that she's been to recently with some questions. It's, as a doula myself, it's so nice to be able to process and talk about it. And, our last podcast, really hearing my client process it too was really interesting.
It really was great.
So we're excited to hear from Sue Ellen, but we also want to remind you guys that we're doing this new series on stories from your clients. So please don't forget to write us at ToRaiseQuestions@gmail.com.
Right. And any case studies you yourself want to discuss, we love them. Our listeners love them. I'm always learning from these experiences. It's really a great learning tool for me, as well as I know for everybody else. And any other questions that you have, we try and get to the questions as best as we can. Sometimes that's just what we do. We run through 4 questions that we've received. So send them in. If you haven't heard from us and you had something you requested a while ago and haven't heard, send it again. Just poke us a little bit there. So we'll be right back with Sue Ellen. Hey, is this Sue Ellen?
Yes, it is. Hi.
Hi, this is ToRAISE.
Hi, Sue Ellen. This is Melanie.
Hi, ToRAISE. Hi, Melanie.
Well, we are really excited to talk to you today. As we've voiced many times, our listeners love to hear case studies like yours and get a sense of how they might deal with a birth situation, based on how you did, what our input is, the whole scenario. So we really appreciate you taking the time to call us in, from Wisconsin.
Yeah. I really appreciate the case studies. Also, they're great.
Great.
Sue Ellen, would you mind giving us a little background on just how you became a doula, what brought you to birth work, and if you have any children yourself?
Sure. Yeah, I have a 2-year-old, and she was born at home.
Nice.
Myself and my 2 brothers and my younger sister were all born at home also, and so I just grew up in like the birth is normal kind of world.
Oh, that's so great.
That's nice.
And I feel very fortunate for that. Yeah. And I witnessed the birth as just an observer when I was about 12, and was able to, I wrote an essay on that experience for school, and that was really amazing as like a 12-year-old.
So cool.
The birth, and then it was crazy. But it wasn't until like 2 years ago.
I'd love to know what your teachers thought of that essay.
Right.
Well,
it was like
go ahead.
It was in school, and so we would meet every 2 weeks and go over like the homework and stuff. So it wasn't your regular like middle school.
Gotcha.
Yeah, and it was Northern California, so that makes a difference as well.
Right. Yeah.
I just remember when I had my third baby and my 2 older kids were in preschool. They were 3 and 4. And there was another mom in the school who had her baby over the weekend as well. And my kids came in who had attended the birth and said, our baby came out. Or no, the first kid came into school and said, my baby came out of my mommy's tummy. And my kids were like, what? Our baby came out of my mommy's vagina. I got a call from school that day. Sorry, Sue Ellen. So tell us how you really got to birth work and when you started practicing as a doula.
Yeah, so about 2 years ago, my sister-in-law got pregnant again, and she was a VBAC, and she found a VBAC from the hospital. This was in New York. And she asked me to just come and be like extra support. She didn't end up breastfeeding with her first because she didn't have anyone telling her that she could. People were just like, oh, supplement with formula, no big deal. And she knew that she wanted to do things differently, but she didn't really know how. And so she just asked me, having been through it, to come and like just help her out and be a positive support for her. And so I started just like reading and studying about birth, and then realized that you could be a doula as a career and you could just do that.
Yeah.
And so I signed up for a certification program and have been working on that. I'm really, really close to completing certification. And I just attended my second birth 2 months ago.
Okay.
Great. Good for you.
So new to the actual work, but been exposed to birth your entire life, which is and from that facet, that perspective of physiological normal birth. Which is
because birth happens and it's fine.
Well, great.
For the most part.
Great. So do you want to give us kind of an overview of the birth that you would like to discuss with us and what your questions are?
I do. Yeah. The one I would like to talk about is this most recent birth, my second birth that I attended. We had connected on social media as just like moms in the area, and she posted looking for a doula, and I said, hey, I'm a doula. And so I met for an interview with her husband. And it was her 5th child, and they had, all of her births had been vaginal births, but the first 3 had been in the hospital. And so she was really looking forward to a second and final home birth, as it would be her last child, because she's done after 5. And she had a home birth midwife that seemed really supportive until it got like closer and closer to the time. She kept bringing up like, well, in the case of a transfer to the hospital, and like all of these different kind of like scary scenarios where of course you want to talk about them and be aware of them, but not like be expecting them, and the couple just kind of felt like she was setting up the expectation of transfer, and they had discussed that with her. They had a conversation with her about how they were feeling, and because they were thinking about switching and finding a different home birth midwife, and they ended the conversation feeling really fine and positive and reassured about everything.
Okay, can you
back up a little bit?
Can you just repeat?
Yeah.
What were the questions about this specific provider?
she knew, the mom knew going into it that the midwife had a high transfer rate, but she was confident that she would be able to have a home birth still because she's had one before.
And did the midwife explain what was the main reason for that high transfer rate?
I don't think so.
Okay.
Not that I know of.
Okay.
And there had also been a couple of times where, like, they were supposed to have a home visit and the midwife never showed up. And then when they got a hold of her, she was like, "Oh, I thought you were supposed to meet me here." And so she was just kind of like flaky a little bit there,
Gotcha.
you know? And yeah, and so those were like their main concerns, was that she was a bit flaky and had a high transfer rate. And so they brought that up and they ended up feeling fine with her answers, you know?
Okay.
So then her water broke, having some like early prodromal labor for a couple of days. And then her water broke at 9 a.m. one morning. And so we all met at her house, and she had kind of high blood pressure, and she had really great blood pressure all through pregnancy. And then after the water broke, it kind of went up, and she wasn't having any contractions or anything. And so the midwife told her to, you know, snuggle in bed with her husband, just had to relax. And we all left and came back at like 6:30 p.m. because we were, you know, just kind of see if anything would pick up during the day, and it hadn't. So we met just to make a game plan for the evening. And it was then that the midwife asked her to explain what happened when her water broke, because she realized that she didn't even like hear the story. She was just like, "Oh, your water broke. Great. Well, I'll meet."
Can I ask you real quick again? So was she having minor contractions, did you say, or no contractions?
No, she was pretty much contractions. You know, maybe like a little bit of tightening, but nothing that was noticeable.
Okay. So you're there at 6:30.
So that evening, Right. And so they were walking when her water broke, and she felt a gush, and she was short with her water. She had recently peed, so she wasn't sure it was that. So the midwife did the test strips to test for amniotic fluid, and it came back negative. And so from that perspective, she was pretty sure that the water hadn't broken, or it had been, you know, kind of like sealed up or something. And told her to do the baby was kind of posterior. And so she told her to do some mild circuit as she was, you know, going to bed, and maybe things would pick up overnight, and then we would talk again in the morning. And then of course the next morning would be 24 hours after the water broke, in the fact that it had.
If it had. Right. Okay.
So like in the morning, she called the midwife, and they scheduled a non-stress test at the hospital just to go in, and I feel like mainly to like cover the midwife side of things.
Sure.
Because it had been 24 hours then.
Sure.
So that was the plan, to go in the afternoon, and then all of a sudden the mom's calling me again saying, "Well, my cholestasis lab results came back really elevated, so we're going to go in at noon for an induction."
Well, okay, so hold on 1 second.
Okay.
So, because maybe it's just me. Did she, the next morning she was supposed to go in for a non-stress test. Is that what you said?
Right.
Was that supposed to be
they talked
in the morning?
They talked in the morning. They talked in the morning and scheduled the non-stress test for the afternoon.
For the afternoon, okay. And then when she called you, it was still morning time. Yes.
Yeah.
And she said what?
Yeah, it was like an hour later.
Okay.
She said that she had been worried about cholestasis like the week or so prior, because she had really itchy palms. So she went in for some lab tests, and had gotten them back that morning, the morning after her water broke, and they were high cholestasis results. So the midwife decided to go in to the hospital for an induction and transfer care to the hospital instead of trying to do home birth.
And did she explain to her concern about that, why there was a concern?
No. And then I learned later, because I had kind of, for some reason, that had just totally left my brain, that was like the reason that we were there for the induction, after just trying to schedule the non-stress test.
Right.
And because no one brought it up while we were in the hospital, the home birth midwife didn't bring it up, because she followed us to the hospital as like an extra support person there. and the midwives in the hospital didn't bring it up at all. And so after, the mom was like really confused as to if that was even true, that the lab results were high, because if not, why wouldn't they say anything about it then? And so we got there around noon, and they tested for amniotic fluid twice because they wanted to be sure that her waters had broken, because if not, they would just send her home and let her wait it out, and they did it twice, like 2 hours apart, and they did the paper, and they looked at it on the screen to look for ferning, and they both came back inconclusive. They couldn't say for sure either way.
Okay.
And
so
at that point,
was that a feeling though that like, well, then her water probably did not break, given the fact that the midwife had tested it and it showed up negative, that 2 tests were done in the hospital and they were inconclusive, which says to me there's more of a, based on the one being negative already, that it would lean towards the negative as well. Right.
But so that was where they were coming from. But the mom was really convinced that her water had broken. She was like, I know what it feels like. I had just peed. I was walking like my water broke. But she wasn't worried about going over 24 hours. She was just like, I know what that test is saying, but I also know what I felt, so she wasn't ready to just like be like, oh, my water didn't break, even though maybe if she had, they would have said, well, just go home.
Can we back up just for 1 second? So Ellen, can you just give our listeners a little bit of an explanation on what choleostasis is?
And we just realized we should be more clear on that.
I am a little bit unclear on it also. I just know the symptoms of like the itchy palms and itchy feet.
Well, it has to do with the liver function.
Right.
Yeah. And so, I am not
an expert on it,
a doctor.
Right.
But I know I've had some clients that have had some scares and have been induced because of choleostasis. But it is all about kind of clearing out the liver and making sure the liver is functioning properly at the end of pregnancy. And it's pregnancy induced, it goes away. Mm-hmm. But it could definitely be a reason for induction.
Right. So we wanted to be clear on that. So her water, but that wasn't, the issue that brought her in was the choleostasis, but it was
right according to the home birth midwife. Right. But then once we were there,
it didn't seem to be an issue.
Recommended the induction. Right, they recommended the induction because the water breaking was inconclusive, but the mom was saying yes, it broke.
Right. Okay. So is the water really the bag of waters being ruptured seemed to be the main reason from your perspective that you all were there.
Right.
Yeah. Okay. Whether it was conclusive or not, based on the woman herself, she felt like, yes, this was my bag of water that broke. And maybe it did.
Right.
Maybe it was a high leak and it sealed what they were, there wasn't. Because I'm curious, do you remember her leaking more fluid during her time with you?
No, she didn't. She had that one gush when they were on their walk and they walked home, and then she didn't leak any fluids all day. Yeah. And then the midwife, checked and it came back negative on the test strip. So.
And
then again the next day, so there was no leaking.
Yeah. So if it's not to doubt this woman. It very well could have been her water, and it was up high, and it's it plugged itself off, and that's why there was no further leaking, and it wasn't showing up positive. But sometimes also there can be a gush. I've said this before on podcasts of just gushy, liquidy, juicy.
So I'm actually dealing with this right now. Like if you could see me right now texting and listening to you tell your story, because I have someone who
has someone in early labor.
Well, who thought their water broke last night, and then so now we don't think it actually broke.
Yeah. So I'm just putting that out there. It doesn't change the story. It's just one of those things that we have to walk this fine line dance with our clients of not not disempowering them for what they believe and what they feel and what they are telling us, but also trying to help them understand that it might be a great thing that your water didn't break, for the time's sake thing. But
right.
that's it here.
Right.
That's that for now. So move forward for us, please.
Okay. So at noon, and after all of this was said and done, they didn't start the induction with Pitocin until about 5 p.m.
Wow.
So it was a pretty late in the day induction. And they started it really on one, really low. She was really effaced, and I think like 1 or 2 centimeters dilated, and had been having some early labor signs already, like in the previous phase. And so we were all anticipating that we could just like a little get it going, and then her body would take over, and they could shut it off, and that just really wasn't the case. Every half an hour, they bumped it up a little bit more, and her contractions never peaked. She would like start to build and then just like end before they would like peak and taper off. And that went on for quite a while. So they started the induction at, I guess it's all said and done, it happened really fast, but she was like, it was taking forever,
Yes.
And she kept saying she had a lazy uterus. She was blaming her uterus for being lazy and not working with her. And so her and the mom and the home birth midwife opened up this like dialogue between the mother and the uterus. The home birth midwife acted as her uterus and would answer her questions, and like they were trying to like work it out like that. And it was really entertaining. We were laughing a lot as they were conversing back and forth.
Okay, that's good.
And then we went down to the cafeteria to give them some space. We were only gone for about 20 minutes, and when we came back up, her contractions had really increased, and she looked at me and was just like, "I need you," and I felt so bad for leaving, but maybe that's like exactly what she needed.
Yes, more than likely, that's what helped kick it in. Right.
So, but all through it, even as they were super intensifying and getting closer together, she still was saying that they never like peaked and finished. They would just get really, really strong and then just stop. And then they would get really strong and then just stop. And they would be pretty consistent. And then there would be a big break of like 10 to 15, 20 minutes of like no contractions. And they would just pick up really strong again. Let's see. At one point, her hands went numb. She got really worried. She was like having an anxiety attack, and then her hands went numb, and she was like, I don't know what to do. And so we were like massaging her hands and talking with her. And then she was laying in the bed, and then all of a sudden she just got up, and she was like, I don't know how to be. I'm like, we'll figure it out. And later when we talked, she said her to get on her hands and her knees, but she knew the hospital floor was so gross, she didn't want to like get on the floor,
Right.
So she was just like leaning over the end of the bed, standing on the floor. So let me back up just a little bit, because right before all of that, when she was in the bed, she had requested a vaginal exam because she hadn't had one yet.
Okay.
And she was 4 to 5 centimeters dilated with a bulging bag of waters. And so she asked if they would break it.
Okay.
And so they broke the water. And then that's when things really, really picked up. That was maybe at like 9:30 at night or something. And then from that, when she was in the bed, and her hands went numb, and then she kind of worked through that, and then she got up to stand. And we asked if she was ready for us to buzz in the nurses and midwives, because it was just myself, the home birth midwife, and her husband at the time in the room. And she was like, I think so. So we buzzed them in, and they came in really calmly, and we're like, okay, we're just gonna like get the table ready, and like we're here. And then all of a sudden I saw in the reflection of the window the crowning. I was like, I see the head. It was such a cool view. And just a couple of pushes, and he came flying right out, and they passed him up through her legs, and we helped her back up on the bed to lay down. And he had a really short umbilical cord, so he couldn't get all the way up to the breast.
But was he laying like on her belly?
Yeah, he was laying on her belly, and he was there for about maybe like 5 or 10 minutes, and then they were like, the placenta is detached, like we can try to push that out, and they wanted, of course, she wanted to like nurse to help with those contractions, but he was too far down still and couldn't get back up. Where I know I put this in my email, this comes into one of my questions, is then the home birth midwife started stimulating her nipples herself and told me to get the other one, and I was just like, what?
But why what was her thought in stimulating the nipples?
To help bring on a contraction for the placenta, but she was still hooked up to the Pitocin because she'd had it all through the labor. They wanted to keep it on until the placenta was delivered. Sure. And then shut it off.
I think.
And so
Yeah, go ahead.
What?
No, go ahead.
Well, I just felt like that wasn't really my place to do that as the doula or this person. Like, there was midwives there, like, but I was the one standing right there. Like, I was the one that could reach, and I just did it because she told me to do it. And,
I feel like the midwife. It may have, and I'm not her. I don't want to. I'm just interjecting this.
Right.
Can I ask a question before you interject, just to get the whole picture real quick?
Go ahead.
Did the midwife, before the midwife started stimulating her nipples and asked you to do that, did she ask the mom's permission, or did she say, listen, I think this is a good idea if we start to stimulate your nipples, this will help the placenta, like give her an idea of what was happening, or did she just start doing it?
She did. No, okay. She did. Yeah. She said, I'm going to do this. Is that okay? And the mom said yes. And then she was like, you get the other one. And I looked at the mom and I was like, is that okay? And she was like, yeah. And
I think,
it was like,
well, here's what I was going to say. I think it's odd that she would do that. Not because I think there's anything wrong with nipple stimulation, and I understand your discomfort perhaps with it, because it's not really in our norm to start stimulating somebody's nipples, especially in front of other people. But I have done it. I've
done it, and
it can be very appropriate. What does not seem appropriate in this sense is she was on Pitocin. You don't need, unless the Pitocin was not giving her enough contractions. It's why are we rushing this? Let the Pitocin do it. On top of it, why are we rushing this? If it's about getting the baby to the breast, the baby doesn't have to be on the breast. The baby, as long as the baby is skin to skin and close to the mom, that's what matters. I mean, a lot of babies don't even want to nurse right in the beginning. Most don't. 20 to 40 minutes. So to me, if I'm hearing it correctly, it's like she went into mode of, we're at home. There's no Pitocin on. This is what I might do if there was a need to get this placenta out, forgetting that where she was and how she already had Pitocin, and that everything looked like it was okay. At least from my perspective, it sounds like it was.
Right.
So to me...
Right. Yeah, and everything...
Yeah, go ahead.
I mean, everything was fine after, everything was totally fine as far as, like a safe, healthy baby,
And there was no hemorrhaging going on, and the placenta came, and there was no issue with that.
Right.
About how long? And even about how long after the birth did the nipple stimulation start happening?
I thought you said about 5-10 minutes.
Just 5-10 minutes.
Yeah. I feel like 5 to 10 minutes.
Yeah.
Maybe it was time at that point kind of like I wasn't looking at the clock anymore, but it felt like it was very quick. Like she had gotten back into bed because she was standing up, she laid down, and then they were like, okay, it's time.
That's just just doesn't seem really necessary to me. But again, that's coming from me sitting on a couch right now listening to you, not being present.
Yeah.
And so did you end up stimulating her nipples yourself, or did you decide it doesn't feel comfortable to me?
I mean, I guess so. I was doing it. The midwife at one point was like, you know, like, do it like you're a baby. And I'm like a baby's mouth. I'm like, well, this is my hand. I'm not a baby's mouth.
Yeah.
You know,
Yeah.
I've never done this before, you know, in this sense. So I'm not exactly sure the correct movements, but, you know, it was a little just awkward and overwhelming for a minute. And it, you know, because all kind of happened so fast.
I understand.
So, and then they allowed for super delayed cord clamping. They had the placenta in like a little pail that was close enough to the mom so, you know, the baby could be on her chest. And because they had plans, they wanted to do like a cord burning at home, but of course now they're in the hospital and they probably wouldn't like all the candles going.
Right.
So, yeah, so on that side of everything, you know, they were healthy, and everything was fine. But as she was planning for a home birth and then ended up in the hospital with like kind of a scary induction, she's pretty traumatized over the experience and is like feeling like not like she's not like laying blame or like getting really hung up on the what ifs. She's like really processing it well, but she is definitely feeling bad and like, you know, that it went that way.
What does she feel?
And
what does she feel went? What is the, besides disappointment, or maybe that's what it is, disappointment that her supposed last birth did not go the way she envisioned, specifically being able to birth at home, if this is her last birth as well. Is there anything else about the experience that she is questioning, feeling traumatized by? I mean, what is your sense the trauma really is?
I think that it really links back to like previous trauma in her life, because she did say that she felt like really supported by her like support team. She feels like everyone took care of her the best that they could. She's got really high anxiety, and so the nurses and midwives in the hospital were really working with her. Like before they placed the IV drip, they waited patiently at her side until she was like ready for it to happen. They explained everything in super detail as, you know, before and as things were happening.
That's wonderful.
And
that's really good to hear.
Yeah, it was really great. I mean, she was even, she had in her birth plan that she didn't want to put a hat on the baby right away. And so they took the baby's hat in the hospital and like undid it all to put over her IV in her arm. So she didn't have to like look at the needles in her arm.
That's nice.
Yeah, that's a great really little cool. Doula tip right there.
Yeah.
Right. Yeah, it really was. So that was really cool. And yeah, so overall, I think it is really disappointment in the experience. Like I said, she has really high anxiety and like past traumas that she needs to just like feel like safe and secure. And even though she was surrounded by those people that would have made her feel like that at home, she's now in this hospital situation where she's not feeling like safe and in control.
Right.
But it sounds like it couldn't have gone better in the hospital. I mean, with just, it sounds like it was despite the induction and all of that, but the birth of the baby, it sounds like the providers in the hospital did everything they, you know, to listen to her wishes, to accommodate.
Right.
Does she see it that way?
She does. She feels a little let down by the home birth midwife through it all. But she also knows that she saw those red flags to begin with.
So what is her?
And so now she feels.
Yeah, go ahead.
What's that?
No, go ahead. I'm sorry.
Well, I was just going to say, now she feels that like what she's been able to learn through this is like that kind of like how this home birth midwife operates, and so she can kind of like not recommend her to her friends and family in the future.
And based on,
you know.
Okay, so what are your questions? Because I have a question about that, but it may be similar to what your questions are about this birth. What would you like?
Yeah, I guess I do have the question about like if I am working with a client in the future who has chosen this woman as their home birth midwife or is thinking about it, like how to share the experience that I've had without like going overboard.
Well,
you know, I don't want to scare them away. Maybe that's the exact type of support that they're looking for, and that would be a perfect fit for them. But
so I want
to
to clarify, because from what you told us of the story, I'm not feeling.
What's that?
From what you told us thus far in this story, I'm not feeling necessarily there's a problem with the home birth midwife. I mean, as far as her support. I mean, she was there in the hospital with her. She was doing things. She was helping. So what is it that I'm missing in this story?
And the choleostasis, that does change her risk factor. So if there were, a higher level of, again, not a doctor, of what they're looking for in screening and testing for that would usually risk her out of midwifery care, even in a hospital setting, and transfer to physician care.
Right.
So
what is it? Yeah, because if you feel questionable about this midwife and your client is feeling like she doesn't know whether she would recommend her, what is it about her that we're not quite grasping, besides the fact that she seems to have a high transfer rate with her clients?
Right. I think from this client's perspective, the high transfer rate was definitely one thing, and then just kind of the overall flakiness of her like not showing up for appointments or being like really readily available for phone calls or answering her back right away.
That I forgot about.
That's a big one.
That is a big one.
Right. And then I even have further experience now with this midwife. I haven't worked with her again, but a acquaintance friend of mine recently had a home birth with her, and she stayed at home. They didn't transfer. But when she went into labor and called the midwife, the midwife called her back like an hour or two later, and then still took over 4 hours to actually get to her house. And she was GBS positive and not comfortable being home for too long. And she was like, I'm about ready to just go to the hospital without the midwife because she's still not here yet. And then she showed up and everything turned out fine. But there was another red flag of that, lack of communication there that makes me nervous recommending her for sure. But then if there's a client already working with her, I don't know if there's anything to say,
I think it's hard
there.
if you are hired by a client who's already with her. I think it is hard to say she's flaky.
Right.
You can't trust her. She doesn't show up to appointments. I think that it's a very, it's a dance to.
It's asking the questions.
It's asking the questions and guiding them to ask the questions.
Right.
And
it's
so
more
you're
like
kind of leading them a little bit.
Yeah. How are you feeling about your care? And tell me about it. And how does she, how are your appointments?
And maybe leading in a way that, I'm so glad you're working with a home birth midwife, and, the appointments that come along with that. It's so nice to feel safe, and it's so nice to be able to have the appointments in your home, and then waiting to see if anything comes up from that conversation.
Because they may then say, well, my appointments have been really erratic, or and you can ask for details of, so how are your appointments, and what do you guys cover?
Right.
And
how often do you see her?
Yeah, and do you communicate with each other? What is the protocols that have been set up? So, and
when does she want you to contact her?
And you're asking it because from that sense of you're getting to know who this person is, and you would ask this of about any provider that they're seeing.
Exactly.
So if they have them, like Melanie says already, you have to be very careful. If they are in the process of thinking of changing to, say they're a hospital, you have them, they're 5 months pregnant or so, and they're already planning a hospital birth, but now they're starting to consider home birth, and they're looking at home birth midwives, then you have a little bit more leeway without being defaming to them. And because, everybody is the person, like they'll choose you, and then somebody else won't choose you, and somebody will really think, oh my gosh, Sue Ellen was the perfect fit. And somebody else, might meet you in an interview and go, well, yeah, she's really nice, but I don't feel like she's the fit for me. So we can help people shop around for and you can be somewhat honest, and I say somewhat honest is is kind of a contradiction there, about her reputation, to be honest.
I think more so if they're bringing up the fact that they feel a little unsure.
Well, I'm thinking about shopping.
Oh, when they're shopping.
Yeah, I'm talking about shopping.
Yeah. Right. If they haven't hired her yet.
Right. So how are you feeling? And I'm questioning this only because some people, obviously, many families have chosen her, and many like her. There are some, though, to be perfectly honest, who feel like sometimes she's not as communicative as they would have preferred with her.
Or available. Might be a good way. Yeah.
Right.
So we do this with other care providers, including doctors. Now,
as far as, C-section rates, episiotomy rates.
If you know for a fact, though, that this midwife is really kind of quote unquote dangerous, where she is keeping people home way past the point of reason, because she doesn't want to go in.
Right.
Or she transfers people at the drop of a hat just because it's more convenient for her. Then you should be more transparent about that. You should be clear about, and I would want to know if this midwife has a high transfer rate. First, I'd want to know, is that true? Is it because I hear rumors about care providers all the time, all over the place, and I think, well, where did you get that information? Is that based on multiple sources, a fact, or is that one person told you they have a high transfer rate, and so we take it as true? That means they transferred 3 people in of the 40 people they saw that year, or 5 of that 40 or something. So I'd first want to know that. And then if indeed it is a fact, I would want to know why they got transferred in. There are midwives who take on primogravidas, first-time mamas who have a high transfer rate, and it's not based on any other reason that except for the primogravida labor is often endless and intense, where the client themselves feels like the only thing they can do to get through the labor is get pain relief, and so they transfer in for an epidural. So that can fall into statistics as well of a midwife who may not have a high transfer rate for any reason except for the client themselves says, I need pain relief, and they've done everything that they could. So I think that's a place to start for you, Sue Ellen, to figure out also if you can get clearer on what that transfer rate, for instance, is, so that you can feel, okay, that's a legitimate thing, or be able to balance it out with people and say, well, from my understanding, that's kind of not totally true. The flakiness aspect, that's a big one. Personally, professionally for me, if people aren't showing up, when you said that the midwife said they had an appointment with the midwife and she never showed up, and then when they asked, contacted her, and she said, oh, I thought we were going to meet somewhere else, that to me just is not okay, because if that was even true, then why didn't the midwife call them and say, hey, I'm waiting for you, where are you guys?
Exactly.
To me, that we say that in doula trainings, this is what I talk about. If you can't show up, if you have to be able to be in contact. Yes, it may take you an hour, 2 hours, and even if the 4 hours transpired with the acquaintance that you mentioned, if there's a good reason and there's communication still happening, that's okay. But if the person is not communicating, then that to me personally, and again professionally, is a big red flag.
Yep.
I would be
Right.
uncomfortable
Right.
with that. Yeah.
What I really got from the whole experience, as far as like my understanding of this home birth midwife, is like through our talking in the halls while we were giving them some space during labor and stuff, is I think that she's maybe just burnt out. She's been a midwife for a really long time, and she's been busy, you know, like there's not a lot in the area. And she also does other stuff, you know, out of the country. And she's just been going. And so that's like my kind of impression, is that she is like an amazing midwife in her like prime, and is now just kind of like burnt out of the work.
Yeah.
She's been doing it like so heavily for so long. And I know that can happen. You know?
Sure. And was she communicating with you at all about the client during that time that you were walking with her?
Yeah, there was. So yes, so this is another big red flag for me personally that I never shared with my client, because I felt like that would be really inappropriate. Is while we were walking the halls and talking, she was very obvious that she didn't want to be there in the hospital, because she was now no longer their primary care provider, but she felt like they needed her, but she kind of felt like they were feeling like entitled to her care and support because they'd already paid her through the birth, which I can understand that. But at the same time, she is in the hospital, and so there's other people to take care of her, but she's the consistent person in this birth experience, where the mom, like I said, has really high anxiety and needs people around that she knows and trusts.
Yeah.
You know,
boy.
which is why I think the midwife did follow her to the hospital, so she could be another, like, you know.
Do you
that
think she
person that
would
she's
not
known through her pregnancy?
Do you think does she not follow through with the clients in some cases? Do you know, like if she transfers other people in, does she not go with them?
You know, I don't know if she goes with them for the labor and delivery in other situations, but I do know that she goes and checks on them in the hospital afterwards, because she was talking about a client that she had in the mother-baby unit that she should like go check in on, because she hadn't talked to her in a couple of days. But she was saying all this in front of like the laboring woman who's like her current client in labor right now, you know? And she's like, oh, I should go down the hall and go check on so-and-so, you know?
Yeah, which sounds like I'm not really here with you. I have somebody else in my mind, which isn't appropriate either. Because
Right. And she would take phone calls. She was like dealing with some drama with like one of her adult sons, and she was like, oh, I've got to go deal with this phone call, and she would like step out of the room.
Sounds a little
and
unprofessional.
Right. She was like catching up on like computer work, like logging clients' info and stuff in her computer while we were in the labor and delivery room.
That, I don't know. I mean, if I'm at a birth, and the mom does not actively need me at that moment, or if I'm trying to give them some privacy and rest, I might go through my calendar and just, you know, I'm still there, but as a doula, and you know,
you're like sitting quietly and doing
right,
stuff.
definitely not talking about any drama that's going on in my life,
and definitely not doing it when there's a need.
Exactly. And you know, a midwife in a hospital would be charting and, you know, doing different things and dealing with being paged for, you know, other patients.
Right. So like maybe if that was the only thing, it wouldn't have seemed so weird to me, because she would have been sitting there quietly. But because she was like
it all adds
openly
up.
talking about drama and taking phone calls and stuff,
it was over. It was over.
You know, Sue Ellen, I think the more births that you attend, though, you will start to see how, you know, even though you're at a birth and you are 100% present for that couple, that mama, that, you know, that pregnant person in the birth, sometimes having real life go on around you in that room can normalize a situation as well. So, you know, the fact that maybe if you're having a conversation about, you know, something else with the care provider, sometimes that can make the pregnant person feel safe.
Right.
That no one is worried. You know, here they are talking about.
As long as we check in with the person.
Exactly.
Because I agree with Melanie too. with the caveat that she would put in there as well, which is, I've had small conversations with a care provider or a family member or something as the person is resting in between contractions, and I'll say, are you okay with this? Because we don't have to talk. And so often the response is, oh no, it really helps because I'm listening and it keeps my mind thinking of something else. So it can be appropriate,
right.
But I would always err on the side of caution and not be, distracted.
And I've also been on the other side of it when nurses are coming in and talking to each other very loudly, and
I've been there when the care providers are talking about the accident that they saw on the way to work, and those or the baby that they were just with, and
inappropriate.
Yeah, totally inappropriate. And in this woman's case, I would say your flags were well heeded. I could see where you were getting flags, because also this is a person who has anxiety, who needs full attention, who wanted the safety of the home, wants the full presence of that experience, despite the fact that she's now in the hospital. She's there under the assumption that there's a potential problem with her health, so that's an issue. They're discussing her bags of water, which she feels very comfortable saying it has broken, and that is in essence, in some ways, a non-issue as well, even though it is an issue. I mean, they end up breaking her bag of water, which says, if she indeed did have that leak, it was high up and it plugged the baby plugged off. I think also what she was experiencing was a fifth baby labor in so many cases. That fifth baby, just the depending on the person, but the uterine muscles aren't as strong. They're harder to get their labor, the pattern together. The Pitocin, was it necessary? Probably not, had she not thought her water broke, or indeed her water did break. And I guess the elevated liver was not an issue, because they never addressed it.
Right.
So I can understand. Right. I think with you and her, you just need to spend time listening to her, allowing her that space to grieve the loss of her home birth experience, and not be the Pollyanna, and not be the one who says, well, but look, this, at least you have the healthy baby kind of syndrome kind of statement.
Yeah, absolutely.
But more like, what did you like about the birth, though? Let's talk about the things that you remember that were positive.
Right. Let's talk about how strong you were.
Yeah. And I remember when, and it was so lovely when the nurses did, and it was really nice when I heard the midwife say, and your husband was so, and putting those things in her, in her mind, not discounting her disappointment, because that's the damage that it gets locked in, but helping her also see the positive in those things. And then, as far as moving forward with that midwife and recommendations and such, I think you just need to play it out with each client that comes along. And, if you do indeed have somebody who has her and you're like, oh, I don't know, just, hold that, keep your ego, your agenda to yourself. And if they are, and we already talked about, you can, ask questions that can be a leading into revelations. But if they are feeling comfortable with this person, then we are, unless there's danger, we're walking the walk with them. And the last thing, and because we need to wrap this up as well, the last thing is you made a mention in your email that when you go into the hospital, you knew your role at the home birth, you were going to be the doula, but then you come to the hospital with the midwife. What is your role? Your role is still the same. Yeah. Do not, you are the doula. You are there with collaborative care. You're doing everything that you would have done Because if it had been a planned hospital birth, you would have been working with the nurses and the doctor and or the midwife. So your role doesn't change in any way. You can feel comfortable asking questions like you would, appropriately so, and, just be that emotional, physical presence for that person.
Right.
Thank you so much, Sue Ellen.
Well, awesome.
Yeah.
We really appreciate you writing us and taking the time to be on the podcast. And why don't you check in with us again after, like, when you get to birth 10 and tell us, how things are going.
Right.
Yeah, we'd love to hear. And if you have any more information about, how you did find out more about this midwife, not to be gossipy.
Right.
It's more like, was it true?
Right.
And what
if your
happened?
Perspective has changed.
Yeah, and I like the idea.
Right.
We're going to do that too. More of have people come back 10 births in.
Yeah.
And give us their insights to
that
doula
would
work.
be a good series.
But
you new doulas out there,
that's
let
right.
us know.
So thank you for taking the time, and you have a good rest of the day. And thanks for listening too.
Thank you. You too.
Thanks.
Okay. Bye now.
Yeah, excellent. Thank you.
Well, that was great talking to Sue Ellen, and I hope everybody enjoyed it. It is an interesting experience to go from a home birth to a hospital and the switch over. And, there are all different kinds of practitioners out there, so I don't want to be harsh on this midwife, not knowing who she is and how she practices, but it is always interesting to hear the perspective of the doula and also of what the client has felt about that person, and then what do you do as a doula with that information. So we appreciate the opportunity that Sue Ellen gave us to be able to discuss that, and I do think it would be great to hear from her and from other doulas who we have spoken to who were early on in their birth experiences. And, like Melanie suggested, maybe 10 births in to give us a call and tell us where you're at with your birth experiences now, and looking back at maybe your first 1 or 2 or 3 births, what you think is different, or, So if you're interested in doing that, again, contact us at ToRAISEQuestions@gmail.com. And just want to remind you about the workshops coming up in the fall. Stanton, Virginia in September, North Carolina in October, and Portland, Oregon, in November. And again, thanks to Latch Mama for supporting us with this podcast. We love having you in our support system. Take care, everyone. We'll be back in a couple weeks.